Our mission at Housecall Providers is improving lives by bringing healthcare home. For over 20 years, we've been helping the frail elderly population in Portland because they could no longer physically get to a primary care clinic. But we've also been caring for members who are dually eligible or Medicaid eligible. When you have multiple chronic conditions, you don't have the energy it takes to get to the clinic every time you need a new thing addressed, whether it's pain, shortness of breath, a change in your health status, or a behavioral health issue. All of these things can get in the way and limit the energy you have for regular health care.
I need my medications and other medical attention to come to me because I'm handicapped. I got to where I wasn't making my appointments because it was too hard to get out.
Jackie's a perfect example of why Housecall Providers comes to see people in their homes. We're helping her manage her chronic conditions. We're helping to keep her healthy as possible and not have to go out in this day of COVID. We like to be able to keep people at home. If we weren't coming to her, she'd be having to leave the house, taxing, long time, hours long, very, very tiring. Or she'd be stuck at home and not getting the care that she needed, not getting some of the socialization she needs. I think she's calling us more than she has in the past, which is fine because we're really helping her and connecting with her where otherwise she might be really much more isolated. My
physical condition has gotten to the point where it's hard for me to do practically everything. And now I have Housecall Providers. The doctor can come to me. I don't have to get ready to go, and I don't have to rely on transportation because medical transportation sometimes never would show up, so I was all dressed up with no place to go.
I am not the average Housecall Provider patient. I am 27 years old and I have end-stage renal failure, diabetes, and gastroparesis. I couldn't leave my house. I was in horrendous pain, throwing up. I couldn't keep food down, water down, nothing. Having a primary team come to my house and help me has opened up doors for me and given me a different life rather than being sick all the time.
It was so overwhelming, and so many new meds and a new diet and dialysis. It was just overwhelming. There's no other word for it. Anyone that needs care in their home, I would recommend Housecall Providers to them. The doctors have been great, the nurses have been awesome. I have nothing but good things to say about them, and they have been my savior.
To be able to practice this kind of medicine that's based on relationship, based on putting the patient at the center of the care plan, that really tries to understand what is going to work for them and their health, is the most rewarding place that I could be spending my time.